Hello and welcome to Ask the Experts, presented by Salinas Valley Memorial Healthcare System. I'm Claudia Otero. It's October, so that means it's Breast Cancer Awareness Month. So today we are going to be focusing on breast cancer, screenings, risk factors, and of course the wonderful and compassionate care provided to our patients at the Nancy Osornio Mammography Center. Joining us today is radiologist Dr. Amy Lantis Stemmerman. Dr. Stemmerman is also the medical director of the Nancy Osornio Mammography Center. Also with us today is registered nurse Jessica Valletto and registered nurse Amanda Countryman. Jessica is a breast cancer navigator and Amanda is a breast health navigator also at the Nancy Osornio Mammography Center. Thank you so much for being here today, ladies. So let's begin with you, Dr. Stemmerman. Please tell us a little bit about the Nancy Osornio Mammography Center.
The Nancy Osornio Mammography Center opened 11 years ago. The Nancy Osornio Center is named for a local philanthropist named Nancy Osornio, who envisioned a breast center with state-of-the-art facilities for the local women and a few men of our community. Our center is an ACR, or American College of Radiology, Breast Center of Excellence. This means that all of our imaging studies and everything we do there is of the highest quality possible and accredited by the American College of Radiology. We offer tomosynthesis, breast ultrasound, DEXA or bone density, as well as image-guided biopsies using breast ultrasound and stereotactic or tomosynthesis guided biopsies.
Well, the center is definitely a great resource for our community, Dr. Stemmerman. You mentioned tomosynthesis, which is 3D mammography. And before we go any further, I would like to show our community members a video which we produced that tells us a little bit more about how 3D mammography works and how it compares to traditional mammography or 2D. So let's watch that video.
Screening mammography is recommended by a radiologist yearly at the Nancy Osornio Mammography Center, and that is because we know that yearly mammography is the best way to find early breast cancer. Early breast cancer is very treatable and often curable. The 5-year survival rate for patients diagnosed with early breast cancer is nearly 100%. Nancy Osornio Mammography Center is very excited to announce and promote our new technology, which is available to women in our community now. This is 3D technology, or tomosynthesis. It is a more accurate mammography examination, and that is because the images that we acquire sweep through the breast tissue, and radiologists can review them in slices. Similar to a CT scan, we can improve the accuracy of our examinations, seeing early breast cancer sooner, as well as provide a similar amount of radiation to the standard doses that are expected with 2D mammography. Early breast cancer is found more often with tomosynthesis. We can expect to find early breast cancer 20 to 65% more often with tomosynthesis compared to regular 2D mammography. So we want women who come to our center to know that if they have a normal screening mammogram, they can rest assured that it is actually normal, it is more accurate, and they will get called back less. We are excited to offer a new technology that has been recently FDA approved called Smart Curve paddles. And this is a more comfortable examination for patients. The expected compression will be easier for patients and more comfortable, and most women agree that this is really important when they have a mammogram.
When do women need to start getting their mammograms? What's that magic age number?
The magic number is age 40. And the reason is we know that 95% of breast cancer diagnosed is diagnosed at age 40 or later in a woman's lifetime. And so screening mammography is recommended beginning at age 40 and yearly afterward. These are the recommendations of the American College of Radiology as well as the Society of Breast Imaging. This is what I recommend for my patients.
There are other cases though, right, when a woman needs to be seen or go to these checkups much earlier than age 40. So can you give us a little bit of information about that?
Certainly. So there are women at higher risk for breast cancer. Starting mammography at age 40 is for average risk women. Women at moderate or higher risk of cancer may need to start screening sooner, and this risk may be due to genetic factors, may be due to family history or other factors including when they started menstruating and other factors. And at our center, we will offer all of our patients a risk assessment that can be performed by our doctors and our nurses so that they know what their average or what their lifetime risk is, and we can help develop a personalized screening examination that's right for them.
Okay. And for a woman who hasn't had that first mammogram yet, and let's say either her mother, her grandmother, her sister, an aunt had breast cancer or maybe a different type of cancer, that's probably a conversation that she should be having with her family doctor, correct? To kind of set her into that path as to when she should be making that first appointment.
I think that's a great first step, is to have that conversation with the family physician. Our center can also risk stratify these patients beginning at age 30, and that way we'll tell you what your lifetime risk is and be able to further let you know whether you should start screening at age 30 or age 40, and whether you need just mammography or if you're at higher risk where you may need mammography as well as breast MRI.
So we saw in that video a woman comes in and gets her mammogram. So I guess what happens? When does she need that ultrasound? What happens then?
Sure. So there are two main ways we use breast ultrasound. One of them is for additional screening in women that have dense breast tissue. And so we will offer screening mammography as well as screening ultrasound. And those are the patients that usually have moderate lifetime risk for breast cancer. We use ultrasound in addition to mammography when there is a clinical finding that needs to be further evaluated, or when we see something on a mammogram that needs to be further assessed.
Okay, so it's great having that other option right then and there. Right. So worst case scenario, you see something you don't like as a radiologist, so then that person gets an ultrasound. Again, you see something you don't like, so what's the next step?
So when patients come in for their diagnostic mammography evaluation, they often will have mammography as well as ultrasound. On the day of their visit, we will look at the images, the radiologist will look at the images and determine if there needs to be a biopsy done. The patient will be notified of her results on that day, and we generally will schedule that biopsy in the next couple of days.
We do want to show you a video of, it's a testimonial. It's about one of our nurses at Salinas Valley Memorial. She is a breast cancer survivor. She's kind enough to share her story with us. So let's take a look.
I'm a registered nurse at Salinas Valley Memorial Hospital. I usually do my mammogram every year. It's been 3 years that I miss my mammogram. It's just like life becomes busy. My mom is a cancer survivor, but I have an aunt who didn't make it. They did the mammogram and then they did the ultrasound, and it's really highly suspicious that the doctor ended up ordering biopsy. I came back, and that's the time I met Holly.
Once she had her ultrasound, we unfortunately spotted what we thought was a cancer.
The doctor right away told me, the first word she said was, "Unfortunately, you have cancer." I was not thinking about myself that time. It's my kids. I have a 12-year-old boy, and my daughter is in senior high school. The acceptance was really hard initially. She was there with me. She held my hand. She's just like my angel during that time.
We just shared smiles and hugs, and I just felt like she was a sister to me at that point. It's important to get your yearly mammograms because they truly do save lives.
I'm so thankful the care that I received from the mammogram center to comprehensive cancer center to the hospital. It's top-notch. I'm just thankful to everybody that they're with me during this journey, and I received the best care that any patient should get. I feel good. I'm back to work, which I love, and right now I'm free of cancer.
Free of cancer, and she received amazing care at the Nancy Osorio Mammography Center at our hospital, and obviously at the Cancer Resource Center. We want to thank Maylene for sharing her story with us. It's really inspiring. We also want to reiterate the importance of yearly checkups and cancer screenings. It's estimated that 41% of adults in this country have delayed or avoided medical care because of the pandemic. Our hospital and our specialty clinics, such as the Nancy Osorio Mammography Center, have processes in place that help keep you safe and healthy. We want to stress that it is safe to return to your regular cancer screening exams, and we encourage you to speak with your doctor about what screening exams are right for you, something that Dr. Stemmerman mentioned earlier. Please do not delay medical care. I would like to move on to Amanda now. Amanda, please tell us about your role at the Nancy Ausonia Mammography Center.
Yeah, thank you, Claudia. So I'm here to just support you in understanding what your breast health plan might be in the future, what your biopsies have been in the past, what your results are, what your risk score is and what that means for you, as well as I do the genetic testing and assessments to make sure that we're taking a look at that to see how that impacts your breast health as well. I'm here to just make these visits less scary for you, as well as help you understand how to maintain your breast health.
You just said something that's very interesting. You said scary, and I think a lot of women, when it's their first time going in for that first mammogram, it can be a little stressful, a little scary. We should probably tell you that you don't need to be scared. You are in amazing hands, probably the best hands and healthcare staff that we have here on the Central Coast. So just please remember that these ladies are there for you, and we are there to assist you and be with you throughout that journey. However, you know, whether it's just coming in and leaving and that's it and coming back a year later, they are there for you. Amanda, can you tell us about the center's high risk and genetic program?
Yeah, absolutely. So every woman who comes into our center, we do a risk assessment on. So that's why we have you fill out that paperwork before registration that provides us with your reproductive health, your personal and family cancer histories, as well as collects your other personal information so that we can put that into our Tyrer-Cusack risk assessment tool to come up with a risk score. And what we do with that score is help you understand what screenings might be recommended and best for you to manage your estimated lifetime risk of developing breast cancer.
And that is great information to have. I know Dr. Stemmerman earlier mentioned that some women with dense breast tissue, for example, may have to also have a
Screening whole breast ultrasound.
there you go, an ultrasound. So there you have it. Thank you, Amanda. I appreciate you providing all that information. Jessica, you are a breast cancer navigator at the SVMH Susan Bacon Cancer Resource Center, and you also work with the Nancy Ausonia Mammography Center to ensure breast cancer patients receive seamless care. So what is the role of a breast cancer navigator, and what does this mean for patients?
Well, Claudia, basically I'm there as a supportive person and resource as from the minute the patient is diagnosed with breast cancer through treatment planning, even through surveillance. I help to alleviate the worries and concerns that go along with a new breast cancer diagnosis. I try to basically be their number one resource. A lot of times in that first 2 weeks after a diagnosis, there's a lot of worry, a lot of stress. Patients may have other exams and diagnostic imaging that need to be done before they meet their physicians. So I'm that person that they can reach out to, whether it's to talk to or simply get their results and help coordinate their care.
Well, you do great work, and I should also probably add that obviously we live in a very diverse community, so we do have bilingual staff at the Nancy Ausonia Mammography Center. So if someone is, you know, watching this and they know somebody who probably should make an appointment but is afraid, is wondering how this whole language barrier might come into play, please don't delay care. We have bilingual staff there to help you and guide you through the process. You know, breast cancer, usually everybody thinks women, correct? So unfortunately, that's not the case. Men do develop breast cancer, correct?
Yes, that is correct. Although it's less common in men, there is the chance men have breast tissue, and so they can also develop breast cancer. According to the American Cancer Society, about 2,600 men will be diagnosed with breast cancer by the end of 2021. So it is important for men to be aware of this information. If they have any abnormal findings or concerns, they need to talk to their physicians immediately so that we can properly assess it.
Okay, and I know that we always talk about women and women knowing their bodies, so knowing what their breasts feel like, what's normal, what's not normal. Is that the same advice for men? I mean, should all men be doing these self-exams at home? Is that something that you would recommend?
I mean, it's definitely good for everybody in general to know their bodies. Men, it may be, they have less breast tissue, so it may be more pronounced and easier, I guess, sometimes to find. But definitely it is a good advice for everybody to get to know their bodies well. And again, just report any abnormal findings immediately. The sooner the better.
Okay. What do you want men and women to know about breast cancer? And this is one of those questions that is for the husband or the boyfriend or of the woman who just got diagnosed, or vice versa, or just knowledge in general about this disease.
I think the most important thing from my perspective is that I want them to know they're not alone. It's scary, like Amanda mentioned, to be diagnosed with a cancer, and so to offer the support. Everybody has a different background, different need. So to be able to offer the support, whether it's emotional or resources within our hospital organization or community, I want to be that person to help provide that care, that extra care to them.
That's great. Thank you for that, Jessica. Dr. Stemmerman, I want to come back to you. Can you tell us a little bit about the MRI program for high-risk patients at the Nancy Osania Mammography Center?
Of course. So as Amanda mentioned, we do risk stratification on all of our patients, and some of our patients are at high lifetime risk for the development of breast cancer. That means that their lifetime risk is 20% or higher. For those women, we recommend yearly mammography as well as breast MRI. So breast MRI is done in conjunction with our partners at SVMC Imaging. And so we do the breast MRI at that facility, and all of the breast MRIs are read by your breast imaging experts at the Nancy Osania Mammography Center in conjunction with all of the other imaging studies that you've had done. So this is one really excellent way to find early breast cancer.
All right, is there anything else you'd like to say about imaging in general, 3D mammography, those yearly mammograms?
So I'd like everyone to know that early detection of breast cancer saves lives. We know that screening mammography is the best way to find early breast cancer and decrease a woman's risk of dying from breast cancer. It is well proven. So I encourage everyone to have their screening mammography yearly, and I encourage everyone to come to our center. Please don't delay your screenings because of COVID. Our staff are 100% vaccinated, and I encourage you to get vaccinated as well.
That's fantastic. And can one just call and make an appointment? Is there something else that we need before doing that?
So we do ask that you get an order from your primary care physician, and we'd be happy to see you.
Okay, great, thank you. Well, to make an appointment, you can call this number. It's 831-759-3091. That number, once again, 831-759-3091. The Nancy Osania Mammography Center is located at 240 San Jose Street in Salinas. It's located right across the street from Salinas Valley Memorial Hospital's ER. The center has a large waiting area where you can wait while physically distancing from other patients. We also have a very relaxing spa waiting area and an outdoor sitting area with a lovely fountain. We also would like to show you a photo of the entire staff at the Nancy Osania Mammography Center. A big shout out to all of you. Thank you for all you do for the community. We really do appreciate everything you do during normal times, and obviously during this pandemic. The last 20 months or so have been very difficult, but we really do appreciate you. In November, we will be focusing on COVID-19 and the flu. Our guests will be Salinas Valley Memorial Hospital Critical Care and Lung Specialist, Dr. Kelsey Gray and Dr. Min Lei. You can watch that presentation on Wednesday, November 10th at 6:30 p.m. right here on Salinas Valley Memorial Hospital's Facebook page. There will also be a Spanish language presentation focusing on that same topic. Our panelists will be Dr. Victor Delgado and Dr. Jaime Gonzalez. Please tune in for that Spanish language presentation on Wednesday, November 3rd at 6:30 p.m. right here on this Facebook page. And as we wrap up, I want to take a few moments to discuss how you can make a difference in the lives of people battling cancer in our community. Generous donors to the Salinas Valley Memorial Hospital Foundation help provide funding for the quality care and services provided to our patients living with cancer and their families. Gifts made to our Comprehensive Cancer Care Fund may be used to provide funding for inpatient oncology services and for the state-of-the-art outpatient infusion center. Funds may provide critical resources at no cost to patients, including education, support groups, patient comfort bags, wigs, and headscarves, and can even help with basic needs like transportation. Your support of our patients diagnosed with cancer, including breast cancer, will provide care and resources during what is sure to be one of the scariest and most stressful times of their lives. For more information as to how you can help, please visit svmhfoundation.org. Well, I want to thank our guest today, Dr. Amy Lantis-Stemmerman. Thank you for being here today. Also, Jessica Valero and Amanda Countryman. We really appreciate all the information and the advice and, of course, everything you do every single day for our community and our patients. We thank you for your time and your expertise, and hopefully we'll see you here again sometime in the near future. This video will remain here on Facebook. Please like and share it, and we'll see you right back here next month. Take care. Bye-bye.